Hello, this is Dr. Ramsey Amin. I'm going to speak with you a little bit today about using short or narrow diameter implants to replace missing teeth. There's a lot of controversy out there about what size an implant should be. First thing you should know is that whenever you lose a tooth, the bone is going to shrink. That is inevitable. The longer you wait to replace a tooth, the more the bone is going to shrink. The concept is if you don't use it, you lose it. I'm sure you've heard that before. If you don't use your leg for a whole month, the leg that you don't use will begin to shrink and not be as functional. It'll actually physically look smaller than your other leg if you completely stop using it. Nothing different is in the mouth. When a tooth is lost, the bone gets skinny or loses height, and everything just shrinks altogether, including the gum too. So oftentimes we rebuild the bone through bone grafting procedures, which you can find a lot of information here on my blog about that. But in other times we have just enough bone to place an implant, but we have to use a bit of a skinnier implant or a shorter implant. Generally an implant should be about as tall as your natural roots. It's a little bit of a smaller diameter than your natural roots, but there's certain sizes of implants. There's 3 millimeters, 4 millimeters, 5 millimeters, and big ones are 6 millimeters. So in times that we're using smaller implants, because the implants are smaller, usually we need more of them in order for them to be stronger. If you think of a short implant is kind of like the screws that, have you ever had your pair of eyeglasses lose a little screw? You know that a little tiny screw doesn't have as much of a hold as a big long screw would. So the longer the implant, typically the better, and also the wider the implant, the better. Well, sometimes we compensate. If the bone isn't tall enough, then maybe we can put a shorter, wider implant in. Or if the bone is tall but not wide, then we can put a skinny but long implant. One of the disadvantages of using a combination of a skinny and short implant is it's kind of like a building that was 50 stories high but only supported by a foundation that had 1 or 2 stories deep into the ground. You want the anchor to go a little bit deeper in for the long-lasting strength of the bone. Narrow and small diameter implants are used all the time. I use them quite routinely. Short implants do work. About the shortest we want to go is approximately 8 millimeters. Below that, we begin to get into areas where the literature shows that for years and years, and dental implants have been around for 40 plus years at this point, when using a short, very short implant in an area where you have a high bite force, like the back of your mouth, we may find that the implant doesn't last as long as it's supposed to. So in cases where it's better to rebuild the bone, then that's something I'll recommend for you. In cases where we can replace a missing tooth with a short implant, then that is sometimes a really viable option. If we're missing a whole row of teeth, let's say we're missing 3 teeth, and we want to replace 2 implants and a bridge, if we're going to use little skinny small implants, because they're not as supportive as the larger counterparts, we may want to consider using 3 implants to replace 3 teeth rather than 2 implants to replace 3 teeth. In areas where the bone is very, very small, especially the lower back part of the jaw, it is possible to move the nerve out of the way in order to place implants that are longer and or wider, so that we don't have to build something in a compromised fashion or take risks of putting a short implant too close to the nerve. There is a post on the blog about nerve repositioning or nerve lateralization. Go ahead and check that out if you're looking at having implants for the lower back teeth. On the upper jaw, we'll talk about sinus lifting or sinus bone grafting to increase the height of the bone if a short implant won't work or isn't a good idea for the long term. Everything works for the first year. My goal is to make things last for a very long time. little trouble as possible. This is Dr. Ramsey Amin. If you have any questions, please feel free to comment, and thanks for your time.